am a private-owned practice. However, we do have 4 providers, including myself here, that provide mental health services. Myself, as I've stated, I'm a licensed clinical psychologist. We have Dr. Tamara Godfrey, who is also a licensed clinical psychologist. We have Marjorie Chastain. She's a licensed clinical social worker. And we have Sherry Simpson, who is a licensed professional counselor. And all of us, we have our different specialties, but we do overlap in the services that we provide. And any one of us, we provide therapy and counseling for a range of different issues, from grief, depression, anxiety. A few of us work with kids and adolescents, and so we tend to focus a lot on learning issues or behavioral issues, but also issues surrounding anxiety and depression that children can also experience as well. So in working with children and adolescents, for younger children between ages 5 and let's say 10, some of the bigger issues, or more common issues I would say, are issues related to learning challenges. And so we do a lot of testing around that to understand that child's strengths and weaknesses and learning profile, so that we can try to help support them in the schools. We also tend to see children that are struggling with some attention issues. So many are familiar with the term ADHD, or attention deficit hyperactivity disorder. And so we get a number of children and adolescents that are struggling to focus and concentrate in the classroom and in other areas of life. We also see our fair share of kids that are struggling with how to manage their behaviors and make good choices. And then we do also see children that are struggling with anxiety, so feeling a lot of worry and nervousness. And so we try to help kids learn ways to reduce that anxiety and learn ways to cope with those different factors and triggers that contribute to that anxiety. Well, as I mentioned before, the important thing is to talk about it, okay? One of the misconceptions is that many feel like if they think about suicide, that they're the only ones that think about it. And that could be furthest from the truth. In fact, it's very common for many people to experience having a thought of suicide. And so one of the things some of the things that we do is we do a suicide risk assessment. Generally speaking, that assessment is a big part of what we do here. It's sort of a continuous assessment, if you will. It's not like a one-time thing. So we're always looking for any risk factors and making sure that people are safe. And that's important to us.